Hi everyone, it's Luke here from the Australian Fitness Academy, and today I'm going to take you through this tutorial video on how to complete and fill out the adult pre-exercise screening tool. Now the first thing I would recommend is that you go to your additional resources and download the user guide, which is what you're looking at now on the screen. The user guide is a very valuable tool as it shows you how to answer each question, what to look for in each question, and essentially how to get your risk score at the end of the screening tool. Remember, this is a form which you might get your client to fill out before they start exercising with you, and it will just go through some questions and calculate what level of risk they are in terms of injury or chronic disease in completing the exercise program with you. From the score that you achieve, you can work out whether you need to refer them on or what sort of program you can write with regards to intensity for your client or what modifications might need to be made. So it's a very valuable tool and one that you'll use for almost all new clients that you receive. You may have filled this out yourself at a gym if you've been to a gym. They usually have at least stage one of the three-stage process here. Now it is a three-stage form. Now you will find that stage one is compulsory for all people. Stage two is optional, but it can be completed by someone who's completed the Cert 3 in fitness, like yourselves. And stage three is optional and usually completed by someone who's a bit higher in qualification, maybe an exercise physiologist or someone who's been to uni. So you guys will be or in stages 1 and 2 will be very important for you guys to understand moving forwards. So I'll start with a bit of the disclaimer at the top, and it says here that the user guide for the adult pre-exercise screening tool does not provide advice on a particular matter, nor does it substitute for advice from an appropriately qualified medical professional. No warranty or safety should result from its use. The screening system is in no way, guarantees in no way against injury or death. No responsibility or liability whatsoever can be accepted by Exercise and Sports Science Australia, who developed this form, Fitness Australia or Sports Medicine Australia for any loss, damage or injury that may arise from any person acting on any statement or information contained in the screening tool or this user guide. So just a bit of a disclaimer there to prevent themselves and I guess you as an instructor when having someone fill it out. So let's go through the user guide here and start with stage one. Now, as I said, this is compulsory and should be completed by all or anyone who's starting an exercise program. Now, the aim is to identify individuals with a known disease or signs or symptoms of a disease who may be at a higher risk of an adverse event during physical activity or exercise. So that's the first thing you need to understand. Stage one will determine someone who is at a higher risk. Stages 2 and 3 will look at more moderate and low risk, but stage one, is looking for someone who is at a high risk. So what this stage consists of is pretty much 7 questions. So we look down, we can see here we go through 7 questions. You'll ask these questions. Has your doctor ever told you of a heart condition? These may include a heart attack, angina, coronary artery bypass, heart failure, pacemaker insertion, heart valve disease, etc. So that's what you're looking for when you ask that question. It'll be a simple yes or no. You'll either circle yes or you'll circle no. Do you have experience unexplained pains in your chest at rest or during physical activity or exercise? So any unexplained chest pains characterized by constriction, burning, knife-like pains or dull aches is what you're looking for here. Simple yes or no. Do you ever feel faint or have spells of dizziness during physical activity exercise that cause you to lose balance? Again, either yes or no. Have you had an asthma attack requiring immediate medical attention at any time in the past 12 months? So this might refer to medical attention from a GP, a hospital visit after an asthma attack. It does not include the self-administration of Ventolin or anything like that. So again, yes or no. Specifically, if you've been to the GP or hospital as a result of an asthma attack. If you have diabetes type 1 or type 2, have you had trouble controlling your blood glucose in the last 3 months? So here, yes or no. Again, do you have any diagnosed muscle, bone, or joint problems that could have been made worse by participating in physical activity or exercise? So this could be muscle problems, it could be MS, it could be chronic muscle fatigue, muscular dystrophy, Parkinson's, cerebral palsy. It could be bone and joint related, arthritis, osteoarthritis, fractures, dislocations, scoliosis, etc. So again, if you experience anything like this, yes, or if not, then we get a no there, circle a no. Question 7, do you have any other medical conditions that make it dangerous for you to participate in physical activity or exercise? This could be pregnancy, epilepsy, transplants, cancer, operations, anything of that nature. So yes, circle if that's the case, or no if it's not. So as I said, you'll have 7 questions to go through. You answer those questions by circling either yes or no. Pretty simple process. when we get through this, we're going to go through what circling yes or what circling no means. So I'll come back to that in a second. You then move on to stage 2. As I said, this is optional. Now it can be, and you guys will have to do this as part of your assessment. So whilst it's optional, we get you guys to fill this out as part of an assessment or a couple of assessments. So the aim here is to identify those with risk factors or other conditions to assist appropriate exercise prescription. So you're looking to find any kind of risk factors that may lead to a chronic disease and which can therefore alter the way you prescribe exercises. Now you can administer this stage if you have a Cert 3 in fitness. So therefore we suggest that all personal trainers go through this stage because it's able to be filled out or administered by you. So here we see a number of questions, and the way it works is you'll either be given if the answer is yes, you'll get accumulate risk factor scores. So a yes will be an accumulation of a 1 risk factor, a no will be simply a 0 risk factor. And when we add up all our scores for each of the questions, we'll get an overall total risk stratification score. Now this is the case for almost all the questions, except question 4, which we'll look at in a second, that has a different scoring system. But let's start with question 1. So this question relates simply to age and gender. So are you a male who's under 45? Are you a female who's under 55? If that is the case, then you're going to get you do not accumulate a risk factor score, so you'll get a 0 here. If you're a male equal to or over 45, or if you're a female who's 55 or over, then you automatically get a risk factor score of 1, just based on age and gender. Now, question 2 relates to family history of heart disease. If the client has a first degree relative, so this could be a parent, sibling or child, that has heart disease and is a male and under 55 years or less than 55 years of age, or female who is less than 65 years of age, then they will get a risk score of 1. So if I have a male parent or a father who is 52 years of age, then I will get a 1 risk score here based on my family history of heart disease. If I have say a 62-year-old male father who has had a history of heart disease, then that's still a 0 because they have to be under 55 years of age to be a male, or a female has to be under 65 years with heart disease to get the risk factor. So if they're a female and they've got heart disease at the age of 75, then it's still a 0 because they're not under that 65 years of age bracket. The next one relates to smoking in terms of cigarettes. It could be tobacco, cigarettes and pipe. If you do smoke regularly, then you get a yes, which will be a 1 risk factor score. Now if you've given up within the past 6 months, within that period, you still accumulate a 1 score. If you've given up 6 months or longer ago, then you'll get a 0 score. If you don't smoke, you get a 0 as well. Now question 4 is the different question, as I mentioned before. It has a different scoring system. Now this is all about physical activity levels. Now if your physical activity levels is less than 150 minutes accumulated per week, then you'll get a 1 or a +1 risk factor score. If the physical activity level is equal to or greater than 150 minutes accumulated across the week, then you'll get a -1 risk factor. So there's no 0 score in question 4. Whilst all the other questions can be either 1 or 0, question 4 is either a +1 risk factor for doing less than 150 minutes activity a week, or a -1, which is a positive, for doing 150 minutes or more per week. Now we have a further scoring system on top of that if the client participates in vigorous weighted activity, they then subtract 2 risk factors. So if I do 150 minutes or more and some of it's accumulated to vigorous weighted physical activity, then I can minus 2 risk factors instead of 1. So again, that's an even greater positive because I can take 2 risk factors off. So remember, there's no 0s in question 4. It's either -1 for greater than 150 minutes per week. It's either -2 if you've got vigorous activity, or it's +1 if you do less than 150 minutes per week of activity. Now BMI in relation to height and weight, if you calculate the BMI, which again is going to be kilograms divided by height in meters squared. If your overall score there is equal to or greater than 30, then you'll get a +1 score. If you're less than 30, you get a 0 score. Simple yes or no questions. Moving on here. Having been told you have high blood pressure, you circle yes that you have been told that, then you can get a +1 risk factor. If you've been told no or never had that information relayed to you, then you get a 0 risk factor. Question 7, have been told you have high cholesterol? If yes, you get a +1. If no, you get a 0. Have been told you have high blood sugar? Answer yes, you get a +1. If you know, you get a 0. Now we keep going over the page here. There are some more questions. So just some additional information. The responses to the remaining questions in stage 2, you will not accumulate any risk factors, so your score won't change from what's already been answered above, but rather provide additional useful information concerning the person's health status. The exercise professional should use professional judgment, and if unsure of the implications of a response, refer on to an allied health or medical practitioner for further advice. So questions 9, 10, 11, and 12, you won't get any extra points scores to your risk score, but it will assist you with making decisions. So have you ever spent any time in hospital for any medical condition, injury, illness, past 12 months? Simple yes or no. Are you currently taking a prescribed medication for any condition? Simple yes or no. Are you pregnant or giving birth in the last 12 months? Simple yes or no. Do you have any muscle, bone, or soreness that make the activity worse? Simple yes or no there. So now you've completed stage 2 with your client. So at the completion of this stage, you need to make a sum of the total risk factors from questions 1 to 8. So if we go back up, these were the questions on the first page. Questions 1 to 8, remember each question had a score of 1 or 0, or in the case of questions 4, could have been -1 or a -2. So you add all them up and you get an overall risk score. Now if I go down to the risk, well actually before I do that, let's go to stage 3. Now stage 3 is optional, and we wouldn't recommend that personal trainers administer this. Certainly questions 4 and 5 need to be administered by someone with an exercise physiology degree. Questions 1, 2 and 3 can be administered by a personal trainer, but you've already probably done them in previous measurements, so I wouldn't suggest using questions 1, 2 and 3 to score your risk. I'd suggest using questions 1 to 8 from stage 2 rather than questions 1, 2 and 3 for stage 3. And that's what you're going to be assessed on in your assessment anyway, so look to use questions 1 to 8 in stage 2. Now stage 1, the major aim of stage 1 is to identify, this is the first set of 7 questions we did for yes or no. This was looking to find someone who's at high risk of any kind of adverse event during physical activity. Now the important part here is that if any individual answers yes to any of the questions on questions 1 to 7 on stage 1, then they are advised to seek guidance from their GP or appropriate allied health professional prior to undertaking physical activity or exercise. So a yes on questions 1 to 7 of stage 1 is an automatic referral. That's very important. If you get any yes on questions 1 to 7, straight for referral. Now if they're all no on questions 1 to 7 of stage 1, and you have no other concerns about their health, they are advised that they may proceed to undertake light to moderate intensity physical activity exercise. Now we'll look at what that means in a second also. Now if we look at stages 2 and 3, you can classify a risk based on a score in stages 2 and 3. This will indicate whether the individual is at moderate or low risk. So you've got 2 options for stratifying risk. You can either take the total risk factors from stage 2, questions 1 to 8, or you can take the total risk factors from stage 3 and questions 1 to 4 of stage 2. Now, what you guys will need to do as personal trainers in this course is option 1 there, which is get the total of the risk factors from stage 2. Don't worry about stage 3, you don't need to complete that stage. Now, with stage 2, if an individual scores 2 or more risk factors, they are deemed to be at moderate risk. If an individual has less than 2 risk factors, they are deemed at low risk. If there are extreme or multiple risk factors, say 3, 4, 5 or 6, the exercise professional should use professional judgment to decide whether further medical advice is required. Really high risk factors should be sent off for referral, guys. Individuals at moderate risk, remember this is someone who has 2 or more risk factors on stage 2, may participate in aerobic physical activity exercise at a light to moderate intensity. Individuals at a low risk, less than 2 risk factors from stage 2, may participate in aerobic physical activity up to vigorous or high intensity. So what do those intensities mean? Well, we use the guidelines here. Remember, light to moderate would be someone who has moderate risk factors. So we see anywhere from 40 to 70% of maximum heart rate, RPEs, anywhere up to say 4 or 5. If we look at light and aerobic activity that does not cause a noticeable change in breathing rate, intensity can be sustained for at least 60 minutes. Moderate and aerobic activity that is able to be conducted whilst maintaining conversation uninterrupted. And intensity that maybe lasts between 30 to 60 minutes as a guide there. Vigorous up to 90%, you're looking at higher RPEs there, and aerobic activity in which conversation can generally not be maintained or uninterrupted, and intensity that may last up to 30 minutes. So this might be for someone who is at low risk from stage 2. So that's what the stages 1, 2, and 3 all mean. Remember, you need to fill out stage 1 compulsory. Any yeses on stage 1, straight for a referral. You need to fill out stage 2 questions and specifically look at add up questions 1 to 8 on stage 2 and get an overall risk score. If you get a score of 2 or less, they're at low risk. Score of 2 or more, they're at moderate risk. Sorry, I should say a score of less than 2 is low risk. Score of 2 or more is moderate risk. So let's look at putting this into practice now. So that's the user guide, but this is the actual form itself. So we go through here. This is all editable. You guys will see this in your assessments. You'll need to fill it out as part of your assessments, and we'll go through and fill this out ourselves now. So we'll have a look at this as we go through. We're going to base it off 2 case studies. So we'll do 2 case studies here. So we start with John Doe, 22 years old, male, 60 beats per minute as resting heart rate, 185 centimeters tall, 85 kilos, BMI will calculate in a second. They're a PE teacher, so they're relatively active. No medical or injury conditions to speak of. No family history of heart disease. They don't smoke. 3 days of 45 minutes resistance training sessions. 2 days, 60 minutes cardiovascular training sessions at a vigorous intensity. Blood pressure 125/78. No cholesterol, normal cholesterol levels, normal blood pressure levels, no current medications. Obviously not pregnant, and no pain when exercising. So that's what we're using there. So we go to our pre-exercise screening tool. You fill out the name there. This will be John Doe, and I'll show you how to fill this out. Date of birth, we can just make this up. No problems. We said that the person was 22 years old. So they will be born in 1996. Male, and obviously you can just put the date in, for whatever today's date is. Now if we go through based on that case study, for John Doe, ever been told that you have a heart condition? No. Or some stroke? We saw that, no. Do you ever experience unexplained pains in your chest? No. Do you ever feel faint and dizzy? This would be a no. Ever had an asthma attack last month? This would be a no. Ever have type 2 or type 1 diabetes and has it been, have you had trouble controlling the last 3 months? No. Any diagnosed muscle or joint problems that can be made worse through exercise? So that is a no. Any other medical conditions that might make it dangerous for you to participate in physical activity? No. So this person has received all no's on stage 1, which means they're allowed to proceed onto the next questions without being referred to an animal health professional. So that's a good thing. We'll go on to stage 2 now. So for stage 2, we're going to start here. Fill out John Doe again. For the name. Fill out the date of birth. Whoops. And we'll fill out the date as well. Really important that all these are filled out when you fill out your forms. So we had age there was 22. So I'm going to fill that out, 22. And they are a male. So what does this mean for them? 22 and male means that they're under the risk factor age of 45 or greater for a male. So as a result of being under that age, they get a 0 for their risk factor score. So family history, what do we have here? We had no family history of any heart disease or anything like that. So because we have none, we put a 0. Does the person or this client smoke? We look down, we see that they don't smoke. So again, what do we put here? We put a 0. Now physical activity, So we know that they are vigorous from what we read in the case study earlier. We can see here that we have a vigorous intensity. We have 3 by 45 minutes, 2 by 60 minutes. So all we can do is tick vigorous. We had 3 days at 45 minutes. We had 2 days at 60 minutes. So in terms of total, we have 120 minutes here. We have 135 minutes here. Put together, we have 255 minutes of vigorous intensity. So that's well over the equal to or greater than 150 minutes per week accumulated. And because, again, it's a vigorous physical activity, we give them a -2 score. Remember, that's not a +2, it's a -2. That's very important. We then move on to question 5, which is based on BMI. So let's look at the details here. What do we have? 185 centimeters, 85 kilos. So 185, I need to fill this out. 85 kilos. Their BMI, if I just do a quick calculation here. Now, the way the BMI works, as I said, we need to go and look at 1.85, so it's height in meters squared. So we need to find out what that equals squared. 3.4225. We then go 85 divided by 3.4225, and we get a score of 24.83. Now, in terms of an overall score, that's less than 30, so this person will get a 0 for their BMI score again. Ever been told you have high blood pressure? If we go back to our case study, well, we can look at their blood pressure has been 125 over 78. We know that's in the normal range, so no. High cholesterol, here we see normal, so no. High blood sugar levels, here we see normal, so again, we put no, and each of these will accumulate a 0 because they're all no's. So now what we do is we look at adding up the total score and getting an overall risk stratification score. So we go back up, we add them up. What do we see? We see all 0s, except for question 4, which was a -2, and -2 is a really good result. So this client gets the best possible result on this form, which is a -2. And remember, if we look at our risk stratification score, if we go over the page, I'll just put that in first of all, the bottom, -2, we see that any score of less than 2 risk factors, so not -2, 2 risk factors, is low risk. So this client is considered a low risk client. But we still need to finish up the form, so here we'll have a no for any time in hospital, any medications, no. Pregnant, obviously no for the male. Any injuries, no. So these are all no. Remember, these questions don't actually relate to the overall score anyway, but it's still important that you fill them out. Stage 3, we're saying don't fill this out. For you guys, leave it blank. It's not recommended for the personal trainers. So again, we get an overall risk stratification score of -2, puts the client at low risk, and it means that they can participate in aerobic physical activity or exercise up to a vigorous or high intensity. So they can pretty much exercise any way you like based on their score, which is a really good effort. Okay, so we'll go through another example here, guys. This will be our second client. This is Jane Doe, 165 centimeters, 89 kilos, 56 years old, female, 78 beats per minute at resting heart rate. IT specialist, so pretty sedentary in terms of their lifestyle, or at least their working lifestyle. Injuries and medical conditions, none there. A family history of heart disease. Mother had a heart attack at 42 years of age. 10 cigarettes per day as a smoker. No exercise currently. Blood pressure of 143 over 92. Normal cholesterol levels. Yes, 12 months ago was told they have high blood sugar levels and medication was provided. And medication is obviously there, so for high blood sugar levels. Not recently pregnant and no pain with activity at this stage. So that's our client. Let's go fill out our form again. So we have here, this is Jane Doe. So again, all the details here need to be filled out. So make sure that we do that. You know, we're a female here. And we need to fill in the date, make sure all the stuff's important. So have you ever been told you have a heart condition or have suffered a stroke? No. Any unexplained pains in your chest? No. Any dizziness or faint spells causing you to lose balance during exercise? No. An asthma attack in the last 12 months? No. If you have diabetes, type 1 or type 2, if you had trouble controlling your blood glucose in the last 3 months? No. We did talk about in the last 12 months she had high blood sugar levels, so within the last 3 months is a no. Any undiagnosed muscle or bone or joint problems that could be made worse with activity? No. Any other medical conditions made it dangerous for you to participate in physical activity? Well, if we go back to the profile, let's have a quick look. Probably not really. Possibly high blood sugar levels there, but it's under medication, so that's 12 months ago, so we can say that's pretty good. So we hit no there as well. So make sure we sign the document and we date it as well, and we move on through here. We go to stage 2, which is compulsory for you guys to fill out. So I'll fill this out as I go. Put in the date, and we'll go through questions 1 to 8 again. So we go back to age now. So client 2, what do we have? 56 years of age. So we look at that, we put in 56, we know they're a female. So what does that mean for us? Well, if they're 56 years of age and a female, and we go to our risk stratification over here, we can see that they're greater than 55 in the female. So what does that mean? They get a +1 score. Do they have a family history of heart disease? Let's have a look. So mother had a heart attack at 40 years old. So let's put that in. So mother, 42. So mother is a first degree relative. She's a female and she's under 65 years of age. Therefore, should we get a 1 here as well based on family history? Smoking, let's have a look. We can see here, cigarettes, yes, and we see 10 per day. So it asks how many per day or per week. We put in 10 per day. Because they smoke, they get a +1. Exercise. What sort of exercise is this client currently doing? Well, we go back to our case study and see that they're doing none. They're sedentary. Which means, being sedentary, they get a 1 score because they're doing less than 150 minutes per week. We'll get a +1 risk factor. Now, if we go to our BMI, we calculate that again. Look at our stats at the top. 165 centimeters, 89 kilos. So we put those stats in. 65 centimeters, 89 kilos. And if we do our calculations, we'll get a BMI there. You can do it at home yourself if you like. About 32.84. Now 32.84 is greater than 30, so we'll get a +1 again. Have you ever been told you have high blood pressure? Let's have a look. If we go down, high blood pressure, well, 143/92 is the current score, and that would be considered high, because anything over 140 and certainly over 90 would be considered high, so we'll see a yes here, which once again will be a 1 score. Ever been told you have high cholesterol? Well, it's normal, so we'll leave that as a no, and we'll get a 0 here. Ever been told you have high blood sugar? Back to the case study. Blood sugar, yes, 12 months ago, so we'll put that as a yes, and we'll go 1. So now we need to add up these scores once again. So we have a 1, 2, 3, 4, 5, 6, 7. So a lot different than our last client who had -2. We have a score of 7 here. Now if we go down, answer these questions. No time in the last 12 months in hospital, so we leave that as a no. Any prescribed medications? Yes. For blood sugar levels. Pregnant in the last 12 months? No. Any bone or joint injuries? No. So we leave them as they are. Stage 3, we don't do, so we leave that blank. We come down to the risk stratification for stage 2, and we have a +7. So what does this mean? Well, that 7 is certainly greater than 2 risk factors, so they're certainly at a moderate risk at the very least, which means they can participate in aerobic physical activity or exercise at a light or moderate intensity. However, as was mentioned in the user guide, if you have really high or multiple risk factors, and 7 would certainly fit into that, then you need to make a professional judgment as to whether they need to see an allied health professional or not. Now, I'd suggest this person who is sedentary, considered obese from a BMI point of view, high blood sugar levels, smokes, this person probably does need to be sent off to an allied health professional just for high blood pressure as well, just for a checkup, just to make sure everything's all good before they move on. Now, if someone had a score of about 3 or 4, you can possibly get away with saying, it's okay, I'll just follow the guidelines as suggested by the risk stratification of light to moderate intensity and not send you off. But scores of 6, 7, remember 8's probably the highest score you can get, so 7's pretty high there. I'd suggest for a referral there. And that's it, guys. So hopefully that breaks down for you how to answer or complete the adult pre-exercise screening tool. Remember, you need to fill out stages 1 and stages 2. Stages 3 can be left blank. If you have any further questions, feel free to contact student support. Thank you.